Bonjour Yannick, bonjour à tous. David Boudin, bonjour.
Bonjour Priscilla, bonjour bon auditeur, bon internet.
Merci, vous pouvez rejoindre nous pour suivre la PNQ du jour, une séance que pour la première fois, Oriane Navarre-Marie pour Leader of the House. Il assure l'intérim au poste de Premier ministre en l'absence de Navin Ramgoolam, comme on connaît, peut retrouver actuellement à Nairobi dans le cadre de sommet Forward Africa. Coup double donc pour Oriane Navarre-Marie qui peut retrouver ce matin l'au front bench après sa nomination comme Deputy Prime Minister la semaine dernière. La PNQ, sinon la PNQ de ce matin, axée l'urban récente augmentation de ban maladies transmissibles. Leader l'opposition, Joe Lejonga, qui questionne ministre de la Santé Anil Bichu. D'abord, le nombre de cas confirmés pour chaque maladie à ce jour, en précisant l'état de santé de ban patients ainsi qu'un nombre de décès enregistrés. Ban mesures spécifiques de contrôle et de prévention qui peut faire ou envisager. Capacité opérationnelle actuelle de l'hôpital public en indiquant le nombre de personnel médical et paramédical formés à cette prise en charge et différents médicaments et kits de diagnostic et équipements de protection individuelle disponibles pour la gestion et le contrôle, David.
Oui, donc bonne maladie transmissible, plusieurs types de maladies. Par exemple, en cas de chikungunya, fin connaît faute hausse, plus de 200 nouveaux cas fin enregistrés durant le week-end. D'abord, concentré dans la région Bambou, Beaubassin, Quatre-Bornes et Roselle. Virus là, il finit étant dans les autres localités, notamment à Souillac aussi. Depuis commencement de l'année, 2816 cas fin recensés. À cela, le leptospirose qui propageait avec présence l'ERA, 20 cas depuis le début de l'année, dont 5 cas mortels. Finina aussi des cas confirmés Mpox. À cela, aussi dans cabane infection respiratoire aiguë, avec pas moins 737 nouveaux cas dans l'hôpital au cours de la semaine écoulée. Entre les cas techdismés, 3741 cas fin enregistrés, dont 3000 cas la semaine précédente. Le Radio Plus Grand Matin, Dr Fagil Kalabakos, directeur par intérim, service de santé, fin appelle la population à la vigilance et fin rappelle qu'il y a vaccin contre la grippe disponible dans tout ban l'hôpital pour ban personnes âgées.
Oui, et nous Talela David, en l'absence du Premier ministre, c'est Oriane Navarre-Marie qui endosse le rôle de Leader of the House à l'Assemblée nationale. Et tout le regard ainsi braqué vers celle qui est fait nommée numéro 2 du gouvernement et qui peut prêter aujourd'hui pour passer au premier grand test politique dans sa rôle stratégique là. Et Oriane Navarre-Marie, donc, qui peut monter au créneau lors de la Prime Minister's Question Time.
Oui, un exercice particulièrement délicat pour Oriane Navarre-Marie, Leader of the House, aujourd'hui une première. Les films passent ce week-end pour préparer pour une question adressée au Premier ministre PNQ, tranche traditionnellement donc réservée au chef du gouvernement. C'est une réponse officielle préparée par le service, le bureau du Premier ministre qui finirait mettre après avoir certaines questions inscrites à l'ordre du jour. C'est donc gestion d'une interpellation supplémentaire et un échange direct avec l'opposition qui pourrait tenir l'attention. En face, Oriane Navarre-Marie, Lipona en face de lui, Joe Lejonga, Adrien Duval et non des moindres, ce ancien leader Paul Béranger. Sa séance-là, très attendue, et il pour permettre à la nouvelle DPM de faire monter sa capacité de réaction, d'improvisation, de réactivité aussi, et se maîtrise un dossier qui est souvent très technique. Parmi les sujets brûlants à mardi là, hausse, un accident de la route, affaire trafic de drogue, l'aéroport et situation dans Air Mauritius, aussi construction ban quarters pour la police dans le pays. Et donc, la séance peut commencer. Président Sadia.
Et commencer déjà, David nous prend la direction de l'Assemblée nationale pour suivre cette PNQ de Joe Lejonga, axée ce matin l'urban maladie transmissible et qui est adressée à ministre de la Santé, Anil Bichu.
None. Papers have been laid. Questions?
Yes, Honourable Leader of the Opposition.
Thank you, Madam Speaker. Madam Speaker, I've given notice of the following private notice question addressed to the Honourable Minister of Health and Wellness, whether in regard to the recent outbreak of communicable diseases, he will state the A, number of confirmed cases thereof. In each case has a date indicating the conditions of the patients and the number of related fatalities recorded. B, specific containment and prevention measures implemented or being envisaged. C, current operational capacity of public hospitals to deal herewith indicating the number of medical and paramedical personnel trained for the management thereof. And D, different medicines, diagnostic kits, and personal protective equipment available for the management and control thereof. Thank you, Madam Speaker.
Thank you. Yes, Minister of Health.
Madam Speaker, I would humbly request you to allow me enough time to dwell on this issue as it is of national importance.
Yes, of course, but we need to give him the time also to put his supplementary questions.
I also wish to reassure the House that my ministry is treating the present situation with the utmost seriousness. Madam Speaker, communicable diseases or illnesses caused by infectious agents such as virus, bacteria, parasites or fungus that can be transmitted from one person to another or from an animal, objects through water, environment or vector to a person. In our local context, presently we are concerned with chikungunya, dengue, leptospirosis and mpox. The vectors concerned with the communicable diseases are mostly mosquitoes, rodents and other animals. Chikungunya is a mosquito-borne viral disease caused by chikungunya virus, transmitted mainly by infected Aedes mosquitoes. It usually causes sudden fever and severe joint pain, often with rash, headache, muscle pain and fatigue. Joint pain may persist for weeks or months. Dengue is a mosquito-borne viral infection caused by dengue virus, also transmitted mainly by infected Aedes mosquitoes. It may cause higher fever, severe headache, pain behind the eyes, muscle and joint pain, rash, nausea, and low platelet count. Severe dengue can lead to bleeding, shock organ failure, and death. Leptospirosis is a bacterial zoonotic disease caused by bacteria of the genus Leptospira. It is transmitted to humans through contact with urine of infected animals or with water, mud, or soil contaminated by infected urine. Rats, cattle, pigs, dogs, and other animals may be reservoir. It may range from mild fever to severe disease with jaundice, kidney failure, lung bleeding, shock, and death. It is important to understand that leptospirosis is not one single uniform disease. There are more than 200 pathogenic serovars classically grouped into different serogroups. Some publications refer to more than 250 known serovars overall. Different serovars are associated with different animal reservoirs and may be associated with different clinical patterns and severity. For example, rat-associated leptospirosis is often linked to serogroups such as heterohemorrhagy, which may be associated with severe Wales disease, jaundice, renal failure, and hemorrhagic complications. Cattle-associated leptospirosis is often linked to serovars such as Harjo, which may in some settings be associated with milder occupational disease, although severe disease can still occur. The outcome depends on the serovar, the bacterial load, the delay in diagnosis and treatment, the patient's underlying conditions, and the occurrence of complications such as renal failure, jaundice, shock, and pulmonary hemorrhage. Mpox is an infectious viral disease caused by monkeypox virus. It can cause fever, painful rash or skin lesions, swollen lymph nodes, headache, muscle aches, back pain, and fatigue. It spread mainly through close contact with an infected person, contaminated materials, or infected animals. Madam Speaker, with regard to part A of the question, the number of confirmed cases from January 2026 to 11 May 2026, chikungunya 2,816 local cases, of which 102 are still active. The others have been treated and have recovered completely. In addition, there are 5 imported cases which have also recovered. Dengue, there has been only 1 local case and 6 imported cases, all have recovered. Leptospirosis, there have been 21 reported cases, of which 6 have passed away. In Mauritius, the 6 registered deaths are of the severe type. Additionally, all the 6 patients had comorbidities, including one who was brought dead to the hospital. Mopox, there are 2 imported cases. One was a Mauritian and the other one a foreigner, both of whom had come from Madagascar. Both have recovered. Their immediate contacts have been followed up and none have shown any sign of infection. Madam Speaker, since the outbreak of chikungunya and leptospirosis, my ministry has intensified public awareness and sensitization campaign, where activities have been carried out as follows. Community sensitization sessions, 224, health education talk in high-risk areas, 61, sensitization of municipal district council workers, 400, radio TV intervention, more than 200, school media campaign, 9 digital media platforms used, distribution of posters, leaflets, more than 30,000. The key messages have focused on early recognition of symptoms, avoidance of contact with contaminated water and mud, use of protective boots and gloves, rodent control, safe handling of livestock areas, and the importance of seeking medical care early. Larviciding and mist blowing activities are carried out whenever a case is detected. House-to-house inspections and rooftop surveys are also carried out. 25,341 premises were inspected, 524 sanitary notices were served, 2,195 water notices were served, 1,300 statement of nuisances were issued, 2,195 contacts were screened, 1,224 blotting paper were taken among contacts, 105,905 premises were treated with larvicides. Mist blowing activities were carried out at 81,535 locations. Indoor residual spraying was conducted in 1,811 houses. 100,000 male sterile mosquitoes are being released on a weekly basis. Madam Speaker, I am informed by the Ministry of Local Government that dedicated teams have been set up at the level of all local authorities to attend to the cleaning of bare lands for unknown owners, cleaning of public places, fortnightly flushing of markets, rodent control, and issuance of notice on owners of bare lands. The local authorities have so far taken the following actions. Around 3,100 plots of bare land have been cleaned, weekly flushing of markets and fairs with assistance of Mauritius Fire and Rescue Services and larviciding, intensified rodent control either through in-house labor or outsourced services. Around 2,800 notices have been issued, fixing of notice boards to prevent illegal dumping, regular cleaning of drains, and cleaning of rooftops of buildings owned by local authorities. Moreover, local authorities are undertaking sensitization campaign through distribution of posters and public announcements through loudspeakers. Additionally, the Ministry of Local Government is in the process of printing posters to be affixed in public places such as market and fairs, village halls and sports complexes, among others. Funds to the tune of 260,000 rupees have been earmarked for this specific item. In some local authorities, a special service is being provided for night collection of waste, as is the case of Municipal Council of Aqua Phoenix, in commercial areas, including collection restaurant food waste. Madam Speaker, these diseases cannot be controlled by the Ministry of Health and Wellness alone. It is a disease at the interface of human health, animal health, and the environment. This is why a One Health and multi-sectoral approach is essential. Multi-sectoral meetings led by my ministry have been held with the participation of Minister responsible for environment, agriculture, veterinary services, local government, municipal, district council, police department, rodent control services, environmental health officers, public health inspectors, the representatives of hospitals and primary health care services, laboratory services, communication and health promotion teams, the Mijin Sugar State, and other relevant authorities. Madam Speaker, I have personally chaired several meetings with my colleagues, the ministers of agro-industry, local government, and representatives of ministries and other organizations. The meetings have focused on mapping of affected regions and high-risk localities, identification of possible sources of exposure, strengthening of surveillance and reporting, enhancing rodent control and environmental sanitation, drain cleaning and removal of stagnant water, public sensitization in affected localities, protection of high-risk workers, veterinary and livestock-related measures, hospital preparedness and clinical management, review of severe cases and deaths. Madam Speaker, the national response is being structured around the following pillars, which at baseline in national cleaning campaign, strengthen surveillance, immediate notification of suspected cases, standardized case definition, daily, weekly monitoring of cases, mapping of cases by locality, identification of clusters, for example, for chikungunya in Plum Williams, Port Louis, and Black River, analysis of risk factors and exposure history, early diagnosis and laboratory support, strengthening access to diagnostics testing, use of appropriate laboratory methods, including serology and PCR when indicated, faster communication of laboratory results to clinical teams, clear guidance to clinicians not to wait for laboratory confirmation before starting treatment when leptospirosis is clinically suspected. Standardized clinical management, updated clinical protocol for suspected leptospirosis, early antibiotics, timely assessment for warning signs, rapid referral of severe cases, monitoring for renal failure, jaundice, thrombocytopenia, pulmonary hemorrhage and shock, early involvement of nephrology, ICU, and internal medicine teams when needed, especially in cases of leptospirosis, review of deaths and severe cases, audit of all deaths, identification of delays in presentation, diagnosis, referral, antibiotics, dialysis, or ICU care, corrective action at hospital and community level, feedback to clinicians and public health team, public sensitization on risk communication, targeted communication in affected region, information to laborers, livestock handlers, cleaners, drain workers, gardeners, and outdoor workers, advised to avoid walking barefoot in mud, stagnant water, or drains, promotion of protective clothing, gloves, and boots, advised to seek early medical care for fever after exposure to mud, flood, animals, rodent, or contaminated environments, rodent control and environmental sanitation. The Rodent Control Department Unit has a central role in national strategy. Details regarding the Department Unit are as follows. Rodent Control Unit is responsible for rodent control activities in all public health institutions, warehouses, and offices of the Ministry of Health and Wellness. 36 staff are involved in rodent control activities daily. Activities consist of placing rodenticides and baiting, attending complaints and inquiry around the leptospirosis cases. Additionally, glue traps are also being used. Number of intervention, 2024, 9,751, 2025, 25,492. The strategy for leptospirosis includes intensified rodent control in affected localities, baiting and environmental cleanup, clearing of illegal dumping sites, cleaning of drains, improved waste management, removal of stagnation water, action around markets, rivers, canals, livestock areas, and high-risk residential zones. Madam Speaker, occupational health measures, high-risk workers include laborers, cleaners, drain workers, waste handlers, gardeners, sewage workers, veterinary workers, and abattoir workers. Measures include the use of boots and gloves for protective clothing, education on early symptoms, reporting of occupational exposure, early referral for medical assessment, workplace risk assessment. The national strategy for these diseases is based on a One Health approach, recognizing that the disease sits at the intersection of human health, animal reservoir, rodent, livestock, water and sanitation, and the environment. To summarize, our strategy includes enhanced surveillance of suspected and confirmed cases, rapid reporting from hospital, clinics, and laboratories, early clinical recognition by doctors and nurses, immediate treatment protocols, especially for febrile patients with jaundice, renal impairment, thrombocytopenia, or relevant exposure, audit of deaths and severe cases to identify preventable factors, strengthening of laboratory diagnosis, including timely testing, rodent control and environmental sanitation in affected areas, multi-sectoral coordination with local authorities, agriculture, veterinary services, and environmental health team, protection of high-risk occupational groups, public education and risk communication, mapping of high-risk zones and targeted interventions, regular reporting to the Ministry on progress, gaps, and corrective measures. The present situation is being dealt with in a serious, structured, and evidence-based manner. The Ministry will continue to inform the public transparently, strengthen early diagnosis and treatment, carry out audits of deaths, and work with all relevant ministries and authorities to reduce transmission, prevent avoidable deaths, and protect the population. Madam Speaker, with regard to part C of the question, all regional hospitals and designated health institutions are equipped with isolation and treatment facilities for infectious diseases. The new Suyak hospital serves as a designated admitting institution for highly infectious diseases due to its proximity to Sasisagar Ramgulam International Airport. Strategic stockpiles of personal protective equipment, disinfectants, medicines, laboratory consumables, and infection prevention and control materials are maintained. Laboratory diagnostic capacities have also been strengthened through collaboration with organizations such as World Health Organization, the Indian Ocean Commission, and Africa CDC. Sanitary officers are posted at the airport and port on the roster basis to screen incoming passengers and vessels. Free practice is granted to vessels only after clearance by my ministry. Incoming passengers are required to complete the Mauritius all-in-one travel form, and particulars of travelers arriving from affected countries are transmitted to the certain regional health officers for follow-up surveillance. Blood and sputum samples are taken whenever required for laboratory analysis. In addition, dedicated general practitioners have been deployed to strengthen surveillance against imported infectious diseases. Enhanced surveillance protocols are implemented for passengers arriving from countries affected by diseases such as Mpox, including physical visit, telephone monitoring, immediate referral procedures where necessary. With regard to part D of the question, I am informed that my ministry has sufficient stock of essential medicines, diagnostic kits, and personal protective equipment. With regard to the outbreak of chikungunya, dengue, leptospirosis, and Mpox, the following are available. For preventive measures, vaccine for Mpox, mosquito repellent cream, personal protective equipment, sprayers and insecticide, rodenticides and rat glues, laboratory testing kits, impregnated insecticide bed nets for treatment for all outbreaks, analgesic oral intravenous, antibiotic oral intravenous, anti-inflammatory in oral form. All essential drugs needed to manage critical cases and intensive care are available in all regional hospitals and medical clinics. Madam Speaker, I wish to highlight that the public also has an important role to play in fight against chikungunya, dengue, leptospirosis, and Mpox as a responsible citizen by maintaining the plot of land in a clean state. However, we have observed that many of our citizens are not maintaining their lands, thereby causing public nuisance to the neighborhood. I wish to highlight also that in 2024, there were 9,393 cases of dengue and 8 deaths due to dengue. In 2025, there were 55 cases and no deaths. I am confident that the decision taken by the government as far as public health and sanitary measures are concerned will bear their fruits and that we will win this battle against the spread of these diseases.
Thank you. Yes, your first supplementary, Leader of the Opposition.
Thank you, Madam Speaker. What a good coincidence, Madam Speaker. Today we celebrate the International Nurses Day. Allow me to pay tribute to all those nurses who work very hard in this country to protect us, Madam Speaker. Madam Speaker, in the figures given to the House by the Honourable Minister, can you confirm to the House whether they include also cases reported in private clinics?
Of course. My ministry is a meeting point of all the different departments that we have, whether it is government or non-government organizations.
Okay. Yes, second.
Yeah. Let me start with leptospirosis, Madam Speaker. We have now, the Minister confirmed, 6 disease and 21 confirmed cases. Can the Honourable Minister inform the House why there was a delay to establish that the last victim from Bamboo in fact passed away due to leptospirosis?
Madam Speaker, well, this is out of the 6, all of them had commodities, that is other complications. And there was one patient that was brought dead in the hospital. I know of 2 cases, one on the dying bed was brought to the hospital, and if I'm not mistaken, the one who was brought from Bamboo was one who was almost dead. So if they have not, yes, the deceased was brought dead from Bamboo, was already dead. He had not undergone any medication, nothing. And the test was, yes, that is, the test was repeated 3 times, but unfortunately he was brought dead. And similar has been other cases also. There is one case of Condé Masque. The man was almost on the dying bed, and there was nothing was done because he was alone living in the house. And when his relatives found out that he was not coming out, they inquired and then they brought him nearly dead. So these are the cases we can't do anything. But definitely we are on our guard. Any such cases that is coming where we can save the life of those people, we are going to do it. And again, this leptospirosis, I have mentioned there are about 250 types. Unfortunately, I am told Mauritius, we have got the most serious type compared to La Réunion and other countries.
Okay, yes, third
Yes,
question.
I'll come to that later, Madam Speaker. Can the Honourable Minister confirm that the observed mortality rate in the country, and he said 6 disease, exceeds WHO benchmarks, which is between 5 to 15%? And if so, will he inform the House what specific factors are contributing to that high rate of death, Madam Speaker, and that
I
disparity?
have just mentioned, unfortunately, there are about 250 types of that disease. We have it in La Réunion, and it is important to compare Mauritius with Réunion carefully and scientifically. First, the denominator may be different. Réunion is most likely detecting and reporting many mild cases, and therefore its case fatality rate will appear lower. Since Mauritius is detecting and reporting mainly severe hospitalized cases, our apparent fatality rate appears to be higher. Second, there may be differences in case definition and reporting. Some countries include suspected, probable, and confirmed cases differently. These change the denominator and therefore the calculated mortality rate. Third, there may be differences in circulating reservoirs and reservoirs. Studies from Réunion have apparently identified cattle as a major reservoir, while recognizing possible role for dog, cows, and mice. The local mix of reservoir and reservoirs may influence clinical severity. In Réunion, there has been a shift in the reservoir causing leptospirosis. In recent years, most cases have been caused by Leptospira bupetanacea, which causes less severe disease, whereas prior to 2020, most cases were caused by Leptospira enterohemorrhagic. Fourth, differences may arise for delays in presentation. Patients who present late, already jaundice, breathless or shocked, must have a much higher risk of death. Fifth, there may be differences in comorbidities. Mauritius has a high burden of diabetes compared to Réunion Island, chronic kidney disease, cardiovascular disease, and obesity. These conditions may worsen outcomes in severe infectious diseases, including leptospirosis. Sixth, mortality is strongly influenced by whether patients develop pulmonary hemorrhage, renal failure, shock, or multi-organ failure. Severe pulmonary leptospirosis is associated with particularly high mortality. I just want to explain, you have to compare like with like. Unfortunately, we have a country, we have got more than 20% of our population are diabetic, and that becomes a cause of concern for us compared to Réunion Island.
Yes.
The fact is that we have a mortality rate which is much higher than
your
the
question.
international benchmark, Madam
Yeah,
Speaker.
put your question.
Can the Honourable Minister confirm whether his ministry has undertaken a post-mortem audit or clinical review of leptospirosis cases? And if so, will he confirm to the House that such a review will be initiated to identify systemic gaps in diagnosis and case management?
Post-mortem.
I have already taken the decision, and the expert, or I can call experts, those who are really skilled in that, they have already done the 6 deaths which have occurred. They have already gone through the details, and I can submit a report in the House. I can name the research scholar that I have in my ministry, Dr. Nakshedi. I'm proud of him. He has been a laureate and he's working in my ministry. He had done a thorough study into that. And for the benefit of the House, I'm going to present the operational plan, either whether it is for chikungunya, leptospirosis, or even for mpox. We are ready with all these. I'm going to submit it to the House, and I can assure the House that we are not sleeping. We are working. In fact, we are acting.
Next question.
Yes, can the Honourable Minister confirm to the House that the high rate of mortality is due to late diagnosis, Madam Speaker?
Madam Speaker, I repeat again and again, it's only when, in such a case of leptospirosis, it's only when the patient turns up, he's in his house, we are not aware of it. And as I told you, the first two cases I remember very well of old people, they already have a number of commodities, as my colleague is telling, commodities, too many complications. And then it becomes difficult. It's no question of comparing. Here we have got a problem, our own specificity. But I can assure the House, I have already given you a long list of the action that have been taken by my ministry. Anybody who needs the support, they come immediately before their doorstep and they try to help. So I can say frankly, sincerely, that with limited capacity, we are doing an extraordinary job. I do hope that we will be able to overcome all these problems.
Can the Honourable Minister confirm if the proliferation of rats around the island is due to considerable delays in the collection of solid waste by municipalities and district council? Et tout le monde sait, Madame la Présidente, le pays est sale, Madame la Présidente.
Madam Speaker, the real cause of proliferation and of so much of degradation was because the last 10 years, nothing. That is the real reason. And I can assure the House that in each local authority, wherever you turn, you will see cleaning work going on at an accelerating speed. And I have to thank the honourable member of local government for that.
Okay, your next question. Don't comment, please. Don't comment. Should.
Madam Speaker, can with regard to chikungunya now, can the Minister confirm to the House if his ministry is in the presence of a report from WHO on the chemicals used for fumigation, and if yes, will it table the report?
Fumigation.
You know, I know very well WHO. We have got regular meetings. It's almost regular meetings, and one representative of WHO is in all my meetings, whatever I conduct. And now you have to, first of all, let me explain. And not only that, WHO is giving us full support. I remember, as far as larviciding is concerned, they are in favor of it, but they have been slightly against fogging.
Okay.
Fogging because they say that those insects have already developed resistance. They have developed resistance, hence fogging had to be decreased, in which we have completely eliminated fogging, but larviciding and all these things are already continuing. I am not aware of any chemicals that we are using which is harmful.
Next question.
I understand that he has a report in his possession, yes, whereby, can he table that report in the House?
I'm not speaking of report, I'm speaking of what information is available to me. If there were a report in my hand, without hesitation, I would have submitted. But WHO is praising our government, our ministry for the good work that is being done. And it's not an exaggeration if I say that WHO is also trying to help us financially to combat all these diseases.
Next question, please.
Yes, Madam Speaker, government in 2025 proposed the introduction of sterilized mosquitoes into the wild, starting with the villages of Triolet, where some 80,000 mosquitoes were released. Can the Honourable Minister state to the House?
Male ones.
Yeah, male ones. If this measure was conclusive, and if yes, how, Madam Speaker?
Yeah. It's on not 80,000 now, it's on average 100,000 per week we are releasing in the air, 100,000. But you know, recently, though we are releasing, we can't release everywhere, because where we are having that fogging campaign, larviciding campaign is going on, we are going to kill that what we are producing. So we are not utilizing it in areas where we are using larviciding. We are using it in places where larviciding is not being undertaken. It is 100,000 on an average per week. Yeah.
Next question, please.
Yes, come to Mpox, Madam Speaker. The Honourable Minister has confirmed that we have had imported cases. Can the Honourable Minister inform the House of protocols in place at the airport and the port to detect this virus on passengers?
I have lengthily spoken on that, Madam. I am not going to repeat all those, but I can assure the whole House that complete surveillance is being kept everywhere at the airport and at the harbour also. And all passengers that are coming, I have already mentioned that we are following those passengers, particularly anyone coming from countries which are affected by those mosquitoes. I can assure the House for that. And our ministry is very well known. Our department is known for that. If you come from abroad, they will try to pursue, run after you, unless and until you give your pricks. This is a known fact. So,
One last question, please.
No, I've got two last questions, Madam Speaker. Please, in terms of security at our hospitals, can the Honourable Minister now inform the House whether it has been established how a patient with Mpox managed to escape from the hospital, the Victoria Hospital?
see, during visitors' time of 1 hour, do you think it is possible for my nursing officers to follow someone? So I'm told there was one case when he escaped. But out of hundreds and thousands of people who come and go in the hospital, if one such case occurs, I am not going to blame anybody, nor my nursing officers who are there.
Last one, Madam Speaker. We are facing a virus outbreak on 4 fronts, Madam Speaker, and winter season has just started. Can the Honourable Minister inform the House of his plan to manage this particular period of the year with an abrupt surge in cases of flu and, like I said, the 4 different viruses? Now, in the same vein, I heard what he said, in case of full capacity in our hospitals, and keeping in mind that certain departments might be quarantined to avoid contamination. What is the contingency plan, and will patients be sent home, Madam Speaker?
As far as flu is concerned, we have already started massive vaccinations throughout the country.
Yes.
And anyone who is above 60 years of age, all of them are already getting it. And secondly, during winter, there is a tendency for all these, at least chikungunya, to go down. This is out of experience, during winter. And certainly, as far as the hospitals are concerned, I can assure the House that all measures that were required to be taken has already been taken, and I have no doubt that all those who are involved in it directly or indirectly, they are doing their best to avoid such type of diseases.
Okay, one question, Dr. Mia. Last question, and then that's it.
Thank you, Madam Speaker. May I ask the Honourable Minister in regard to communicable diseases with the recent flare-up of hantavirus on cruise ships and in 1 or 2 particular countries, may I ask him whether his ministry has put a preparedness plan, particularly at borders, so that they are properly screened to avoid having any cases in Mauritius? Thank you.
I thank the honourable member. This is a question which I expected from the opposition. Madam Speaker,
Okay,
but this is a rare but potentially serious infection linked to infected rodents and transmitted through urine, droppings, or saliva. So my ministry is maintaining vigilance through surveillance, clinical awareness, coordination with public health and environmental services. And we are in contact with the international organization WHO and COI also. They are trying to give us all type of help. And in case of any case, even if it comes is a doubt, then of course we have got the National Institute for Communicable Disease, a laboratory in South Africa, and Louis Pasteur in Madagascar. We have got contact with them. We'll be going to send the urine for inspection.
Et voilà donc pour cette PNQ de Joe Lejonga, axée ce matin, l'urbaine maladie transmissible. Question adressée donc au ministre de la Santé, Anil Béchou. Question de Joe Lejonga. C'est nombre de cas confirmés pour chaque maladie à ce jour, en précisant l'état de santé de ban patients ainsi que nombre de décès enregistrés, mesures spécifiques de contrôle et de prévention qui peut faire ou envisager. Alors d'abord, Anil Béchou demande à Madame la Speaker les temps pour qu'il est capable de répondre à sa question-là, vu que c'est une question d'intérêt national. Et la Speaker dit d'accord, mais pour bien permettre le leader de l'opposition pose une question également. D'abord, Anil Béchou dire que la situation peut être traitée avec tout le sérieux. Et il peut dire qui concernant cas chikungunya, dengue, leptospirose et mpox, il revient l'eau ban symptômes, ban mode de transmission et de contamination. L'idée de janvier à mai, au 11 mai de cette année, finena 2816 cas de chikungunya, 102 cas actifs concernant cas dengue et na un cas local et 6 cas importés. Les pédiats concernant cas leptospirose finena 21 cas, 6 décès et tout ban patient qui fait décédé donc tina ban comorbidité concernant mpox, il y a 2 cas importés dont un mauricien. Et David Boudna, Annie Betchou fin lister une série de mesures donc qui fin prend par ce ministère, dont une campagne de sensibilisation, une notice qui fin servi, un nettoyage dans un marché, un contrôle prolifération les rats. Et donc aussi l'idée que l'hôpital de Souillac fin dédié pour un cas grave.
Oui, donc les fins rappellent donc tout ban cas grave que tena sa ban infection là que bien isole ban patient, il a tout l'arrangement qui vient pour ban patient bien isolé et protégé aussi, et qui si jamais une infecté confirme tout, et donc qui jette pas propage encore ça ban infecté les autres du monde avec sa ban maladie là. Donc dans ce réponse les fins de donc une série de mesures qui peut prendre donc pour combattre les 4 maladies transmissibles qui finissent citer chikungunya, dengue, leptospirose et mpox. C'est l'idée donc un campagne intense qui est en cours, et na ban l'herbicide peut nettoyer donc ban la case, ban bazar et surtout ban terrain abandonné. Il y a 3000 terrains que je fin donc fait spraying ban l'herbicide pour nettoyer, et il fait un appel à toute la population. Nettoyage de ban terrain, pas les jeux de ban terrain à l'abandon, parce que ça, il y a un foyer pour ban les rats ou moustiques pour proliférer, et là amène sa ban maladie là. Il y a donc une surveillance peut continuer et partout le pays pour donc contrôle prolifération les rats et aussi ban moustiques aussi. Et il y a donc ce ministère peut continuer avec toute transparence, et donc là il faut ajouter en fait de ce réponse liminaire que l'hôpital Souillac donc pour dédier à sa rôle donc pour isoler et traiter ban patients, et les demandes pour collaboration du public donc et tout ban citoyen pour maintenir la propreté dans la cour partout pour éviter prolifération les rats et moustiques aussi.
Dans ce ban question supplémentaire, David Boudna, Jolie Jonga, fin revin l'eau 6 cas leptospirose, donc 6 cas fatal de leptospirose, et fin revin l'eau un cas à bambou cotipédia qui fait fin tordé pour diagnostiquer, et les fin demander aussi si finena un audit donc après ça ban décès là pour connaître un petit peu qu'il arrivé exactement, et le ministre Anebetou dit qu'il fin l'étude qui fin fait, il fin aussi soumettre un rapport.
Oui, donc juste avant mon rappel, une petite affaire de bonne mesure, il y a aussi conseil de la population régulièrement servi bot avec les gants aussi, chaque fois que je parle de la cour pour protéger eux-mêmes, les fins insistent à plusieurs reprises là aussi, bot et les gants pour protéger. Alors, nous venons à cas ban décès leptospirose. Donc là, le ministre dit comme ça, dans un cas qui fin vini, souvent des cas ban n'a pas fin déclare la maladie, je fin subir elle, et quand je n'arrivais pour soins, et pratiquement total, il cite les 2 cas que ban la fin arrive à l'hôpital dans cas presque décédé ou un cas carrément décédé, et il y a donc situation comme ça, et pas fin récit et très autres, j'ai pas fin vigne de l'avant pour montrer ban symptômes et des problèmes qu'ils ont là donc leader de l'opposition Findia pose la question qui fait le taux de mortalité des plus haut par rapport à les autres pays. Là le ministre finit par dire carrément par rapport à la Réunion, et il y a 250 types leptospirose, et il dit qui mourissent malheureusement nous final tape ce qui peut propager, et avec cas le plus grave leptospirose qui nous gagnait par rapport par exemple à la Réunion, et il dit le système reporting la Réunion aussi différent. Côte là-bas aussi, je peux faire sensibilisation par rapport à élevage bœuf. Je là-bas également, je te mets en garde contre lycéens aussi capables de transmettre ça et les rats. Et donc la sensibilisation aussi, et moyen de faire des différents. et aussi donc le reporting, ban patient je te report plus vite et peut-être plus facilement, ce qui fait un changement. Et aussi ajouter une autre raison à cela, c'est comorbidité, donc diabète qui est un cas qui aggrave la maladie, qui n'a plus qu'à diabète dans Maurice. Et la question si un expert qui fait nous système, comment nous système marché, là il finit dire qu'il est un expert, donc docteur Nokchedi, qui finit en détail là, et finit donc tous nos cas, et il est donc prêt pour soumettre le rapport là-dessus.
Oui, et concernant prolifération, les rats, David, Jolie Jonga, dire que si il y a une prolifération, c'est parce qu'il pays bien sale. Réponse Daniel Bétou, il dit, en fait, finalement, négligence ces 10 dernières années. Finalement, une question supplémentaire encore de Jolie Jonga concernant produits chimiques qui peut utiliser contre moustiques. Donc dans le cas chikungunya, et l'autre question aussi pour l'eau Mpox concernant surveillance dans les ports et l'aéroport, mais aussi Joey Jonga fait une question de ministre de la Santé concernant un patient qui s'est sauvé depuis l'hôpital, donc un cas de Mpox.
Oui, des trois affaires. Donc, le ban produits chimiques, il disait que donc ce ministère travaille en full collaboration avec l'Organisation mondiale de la santé et qui, pour le moment, là, finit comme ça, ok, et l'herbicide, servi l'herbicide, ok, mais fogging, et par rapport à une bactéries, l'OMS décourage ça, parce qu'il y a une bactérie là, je suis plus résistant à sa fogging qui utilise sa produit chimique là. Donc, peut décourager sa fogging là, à plus les herbicides. Là, il fin expliquer et fin poser une autre question là. Est-ce qu'il pour diminuer Pondizef, moustique femelle Pondizef, fin log dans la nature 100 000 par semaine, donc à trioler par tout le log 100 000, mal stérilisé, comme ça là, pena disef qui est clos, et donc ça peut contenir ça aussi, ça peut produire fruits qui donc pour diminuer prolifération moustique aussi, peut donc lâche dans l'atmosphère, dans l'environnement, mal stérilisé pour pena disef moustique pour qu'éventuellement ça cause plus problème. Et l'idée aussi, je dois faire bien attention quand il cause question, encore une fois, l'eau fogging, l'herbicide qui, pas capable en même temps dans la même région, log moustique mal stérilisé et faire l'herbicide bien et faire attention à ça. Et l'idée aussi, par exemple, à Mpox, il a tout protocole qui peut suivre surveillance à l'aéroport et au port.
Alors, on a une question supplémentaire du docteur Omir. Alors, juste avant, concernant influenza, donc la grippe, docteur Anil Béchou dit qu'il y a une vaccination qui peut faire, qui est en cours, surtout pour les personnes âgées. Et cette question additionnelle du docteur Omir concernant antivirus, et il a demandé si finalement, une mesure de prévention, donc en termes de surveillance, qui peut faire.
Alors donc le ministre Anil Béchou explique sa question là et qui
de
donc
l'opposition
et qui donc est content pour répondre ça. Donc il est rassuré que la vigilance l'île de mise au port et à l'aéroport, la vigilance, la coordination avec ban service l'environnement aussi, il dit ça se déroule bien la coordination et vous êtes aussi en contact pour toute l'aide qui l'OMS est capable d'apporter à Maurice pour y faire éventuellement et n'a quelque chose par rapport à antivirus pour contrôler la vigilance et contrôle sa vecteur qui fan donc antivirus là parce qu'il déjà comme on connaît et avec problème avec sa bateau de croisière là l'OMS fin déployer des grands moyens pour assurer d'un port passagers qui infectés je peux traiter en isolation et aussi les autres passagers peuvent retourner dans les autres pays sous surveillance également et qui donc indiquer ce qui est arrivé, le National Institute pour Communicable Disease aussi, fin aussi mobilisé, et si bizarre, pas avoir un échantillon, si jamais il y a un cas, quand il y a doute, pas avoir un échantillon, si bizarre, l'Afrique du Sud, pour analyser.
Sinon, 19 questions à l'agenda de la PMQT. Donc, c'est Oriane Navor-Marie qui peut répondre à cette séance de PMQT. Oriane Navor-Marie qui nous rappelle où peut faire ce baptême de feu en tant que Leader of the House. Une première dans son carrière politique. Au menu, l'accord de libre-échange avec la Chine, la gestion des Mauritius et un accident mortel l'eau nous la route. Un député qui pourrait venir également l'eau récent décès en prison. Des affaires de trafic de drogue impliquant ban policiers ou encore transfert de 3 milliards de roupies du COVID Project Development Fund vers la Silver Bank. Et première question, David, adressée à Oriane Navor-Marie, posée par député Roshan Jamin.
Alors, les points interrogent la première ministre suppléante, les relations commerciales entre Maurice et la Chine, notamment la politique de zéro tarif appliquée à certains produits mauriciens depuis 1er mai dernier, entre autres, pour éviter également le transfert de 3 milliards de roupies dans COVID-19 Project Development Fund à la Silver Bank en 2023, Silver Bank qui peut tenir l'actualité. L'élu de la circonscription numéro 4, Annabelle Savabadi, interpelle Oriane Navor-Marie un accident mortel enregistré depuis janvier 2026, ban cause, aussi ban cas lié à l'alcool, la drogue, hit and run. Député rouge Nitish Bijan, intéressé à Air Mauritius avec ban question. Un avion qui s'y vendait, acheté ou loué en 2014, ainsi que les autres coûts et utilisations et ban panne aussi qui n'arrivait. Alors, elle nous rappelle aussi, il y a 4 questions inscrites aujourd'hui, le ban décès qui ne survenir dans prison récemment. Donc, Annabelle Savabadi, la 9e question, décès qui s'est arrivé aux environs du 30 avril 1er mai et circonstances de l'enquête. Janet Henriette Manon, députée Rodrigue, pose question, le nombre de détenus décédés depuis décembre 2025, mesure qu'il prend pour respecter dignité, ban détenus. Deuxième question, Francisco François, décès détenus, même détenus, qui s'est défilé en 30 avril et 1er mai, et situation de l'enquête, et si l'affaire est référée à National Human Rights Commission et Rubna de Riaou, ici, parce que lui décédé qui vient d'arriver le 5 mai prison de Bassin, circonstances si il a fait une suspens et si il a évidence la caméra surveillance.
Alors sinon 2 projets de loi à l'agenda de mes travaux parlementaires ce mardi, le National Research and Innovation Institute Bill qui prévoit la mise en place d'un nouvel institut national dédié à la recherche et à l'innovation. Ça nouveau l'organisme là pour remplacer l'actuel conseil et qui a comme mission pour mieux coordonner la recherche à Maurice, soutenir l'innovation et alimente une politique publique l'eau une base scientifique fiable. L'objectif c'est aussi pour renforcer la compétitivité de l'économie et réorienter vers une logique de savoir et d'innovation. Le texte qui est au menu c'est l'Electronic Transaction Amendment Bill. Il porte une transaction électronique et donne même valeur légale à une signature électronique ainsi qu'à une signature classique à condition qu'il est capable de vérifier l'identité de la personne concernée. Et ce texte-là, il est également encadré un contrat qui conclut en ligne, y compris qui est généré automatiquement en un système afin qu'il renforce la sécurité de échange numérique. Autant donc pour cette séance de la PNQ. David Boudna, merci beaucoup.
Merci à vous, Priscilla Sadien. Merci nous, internautes et nous, auditeurs qui à l'écoute, qui peuvent suivre nous.
Merci à nous, collègues en régie, Abhishek Sitwell pour le son, également Adesh et Jolie donc pour les images. À très bientôt.